towards us if it doesn't make sense. But like, what's some things holistically that you're seeing out there that are some really good options for treating myofascial pain?
After Cindy when she asked me to do this podcast because she knows that how much I love Shockwave.
Yeah.
Because Shockwave is one of my, it absolutely, as a modality, it is phenomenal. On the human front, if you're looking at things like plantar fasciitis, there's nothing that comes close to treating plantar fasciitis like Shockwave. Any kind of machine years ago when I was very much involved in horse racing and things like that. I don't know if you know, but in the horse world now, we're not allowed to shockwave horses before a race
I've heard about this, but
because they did so well.
I was just going to ask, is it because it's more of that analgesic effect that's happening where they
Yes.
can't, they can move through the pain? Is that what it is?
Yeah.
Okay.
So that's the concern is that the endorphins and the analgesic effect is so successful that it's not just, a lot of things such as certain things like photobiomodulation and light therapy and things like that. Really, really helpful at the time, but it doesn't seem to have the extensivity as shockwave. So shockwave can last up to, the analgesic effect can last up to 72 hours with shockwave.
Wow.
Which is huge. Just looking at it from a pain perspective, if we can take that pain away for 72 hours, think about the processes that we can put into play from a neuroplasticity perspective and a biomechanical perspective to change things repetitively so that, we have this total different neurological input. And I really like shockwave for a number of reasons. There's very, very little that I find personally as a practitioner, I can do with tendon ligaments and things on a really deep level that is super effective. If I'm doing Graston or I'm doing anything like that, cupping, anything like that, it doesn't seem to get deep enough and really hit the weak spot, so to speak, that I'm not creating microtrauma. And that's always my concern. Because if we're doing something physical, the chances of us creating an inflammatory process and creating microtrauma is very high. So now the body doesn't only have to heal the original injury, it also has to heal what I've done to it. And there's benefits with that, like obviously with needles, Graston, all of those things that create vasodilation and a lot of blood flow to an area does bring the blood flow to the area. It does bring all those good mechanisms, healing mechanisms. But now we're also kind of getting this mixed response because we don't know what we're meant to heal first. With shockwave, I really like it because of the angiogenesis side of things. So it's recreating and it's actually creating new blood vessels, which is incredible. We can't do that with anything else. Yes, potentially PRP and some stem cells and mesenchymal stuff. Yes, sure. But it's on such a different level. And the fact that we have seen mesenchymal stem cell growth with shockwave is incredible. That just brings our healing potential up to such a different level without introducing any kind of invasive thing. So it really is one of my top modalities. Laser's helpful. I think that there's been a huge hype in the veterinary world about laser. I think the biggest problem with any modality and any technique, actually, it doesn't matter if it's a modality or not, is it's in the hands of the practitioner. And most of the things where I find that things don't work are either being used incorrectly, so poor technique, or it's not being used for the correct thing at the right time. And so there's PEMF is also exploding. I'm sure pulse electromagnetic. Yeah. I mean, that's going crazy. It's also very helpful with within certain parameters. And I think this is the thing with any practitioner, whether it's a human or veterinary, it doesn't actually matter. You've got to know your parameters. Like, when do we use certain things? Because if we only have a hammer, everything looks like a nail.
I'm just kind of smiling throughout this whole conversation because you're bringing up a lot of tools that I see it in the marketplace, PEMF, lasers, dry needling, and how I normally try to get my arms around things and is just really understand what are we looking to accomplish when we introduce different modalities. Yeah. So I would love to kind of walk through a couple of these with you. One point I want to back up with too is having that numbing effect, right? Especially that they won't let it be used during horse races. Like that's been known, at least when I talk to other doctors, as like a negative impact. right? Because they're like, oh, it's numbing. That's something that's not really getting the outcomes that we truly want from the actual therapy. How did you respond to that?
Look at something really basic and something like TENS, okay? For example. Now, TENS is basically the gate control theory,
Yes.
which is, that's all it is. But effectively, we're blocking a pain control unit and we're changing the way that the body perceives pain. Shockwave is doing the exact same thing. And saying that analgesia is a bad thing, well, break your leg.
Yeah.
Yeah. I don't think it's a bad thing. I think it's a great thing. We're using all these different things, kinesiotape, all of these things to try to change neurology. And if we have an effective shockwave treatment where we are creating analgesia, that is really for me, one of the biggest benefits. Now, I understand it from a racehorse perspective is if they can't feel, they can break an egg. Yeah. And that's lights out. That's ticket. That's the big horse barn in the sky. Yeah. And I think that's really where the issue comes in. So when you're asking an animal to work at a high performance level, by doing shockwave and then potentially having that 72-hour analgesic effect, it could be detrimental only because they wouldn't feel when things are deteriorating like they would at a normal rate. So I think that's where it comes into play. If we use it effectively beforehand and we can moderate the response, I think it's really one of the biggest and most beneficial things about shockwave is the fact that it's got an analgesic effect. Now, that doesn't mean go and then race the horse because that's just counterproductive. But when we're treating like suspensory ligament tears and strains and things like that, and especially things that are poorly vascularized, and we know ligaments and tendons, if you don't screw it up, can take up to 52 weeks to heal. Dinkum. That is categorized. We know that. It's been proven time and time again. So by introducing something that creates angiogenesis and analgesia, we're not only increasing the blood flow to a very poorly vascularized area, stimulating healing, stimulating stem cell growth. We're also preventing biomechanical compensations because that animal or that person is going to weight bear much faster on that leg. We're going to have to do a lot less work later on to treat those compensations. So it doesn't make sense to me that we wouldn't use it in a clinical setting in the right parameters.